I think that's a great starting way to treat both underarm sweating and palm and sole sweating.
Okay.
Very easy to do. It comes with instructions, and it's something you can do. You do it initially for the first week or two, 4 or 5 times, but then it's just maintenance after that to control it, and it works fairly well.
I love that you said that, Dr. Green, because that actually leads me to just a question of mine. As a dermatologist, how do you know what treatment to give or to prescribe to your patients? Is it based on the severity of their condition? Is it really just based on preference or the areas where they get the excessive sweating? How does it usually go?
Well, it's all of the above. So of course, it's of course patient preference because it's what works into your lifestyle the best.
Mhm.
Because if you're not going to use what we recommend on like it's supposed to be used, it's not going to work. So it's
Mhm.
got to fit into your lifestyle. That's first and most important. Now, the things I recommended are really FDA approved for underarm sweating, not
Mhm.
palm sole. Palm sole sweating is a whole different thing, and that's where I think the iontophoresis device, like Dermadry has, really comes into play because it has a very nice palm sole attachment. The anticholinergics you can try for palm soles, but they're not FDA approved, and the same thing with botulinum toxin. So that's where the iontophoresis device comes in very handy for people with palm sole sweating as well.
Right. And I think what I'm getting from you, Dr. Green, is that the iontophoresis is more of like the safe route and the lesser expensive ones than the other treatments available. But just also for the information of our viewers, Dr. Green, we keep mentioning on iontophoresis, which is basically what Dermadry is. Can you explain to our viewers what it is and how it works? How does it treat excessive sweating?
So remember how we talked about the acetylcholine is what causes sweat
Mm-hmm.
to be released, and anticholinergic we have wipes and a gel to treat it. Well, the anaphoresis device works in a similar way by targeting the sweat glands with a little light electric current. So it's not something that you get shocked by. You don't even feel it, to be honest with you. It's but your sweat glands feel it,
Mm-hmm.
and it shuts them down temporarily, just like the anticholinergic cream or gel shuts down them temporarily as well while you're using it. So it's the same type of idea, but a different method of shutting down the sweat glands. And it's very safe. In fact, the anaphoresis devices have been around much longer than the other medications to treat
Right.
focal hyperhidrosis, axillary, under the armpit hyperhidrosis. So it's got the longest track record of any of the treatments available.
Now, Dr. Green, for those that are tuning in, for someone, maybe some of them out there already thinking of trying out iontophoresis, what kind of results can they expect if they start doing it? Let's say if they start doing Dermadry, what kind of results do they expect, and how consistent does the treatment need to be to maintain those results?
So it varies from person to person, but you have to acclimate to the device and you have to use it 4 or 5 days a week for the first 2 weeks. And that's pretty much across the board. But then some people can use it just once a week to control their sweating. Some people twice a week, some people 3 times a week. So it varies depending on how you respond to the device. But it's very easy to use and very safe.
Mhm.
You've got nothing to lose by trying it. And then you decide what you need to control your underarm sweating or palm sole sweating.
Right. And aside from hands, feet, and underarms, Dr. Green, are there also maybe other uncommon areas that people still do sweat excessively in?
Forehead's a commonplace that I see every now and then, and the same rules apply there. You can, same prescription medications. Now, some people unfortunately sweat everywhere. They sweat head to toe,
Right.
um, and they are constant sweaters. So they're not just sweating from their palms and soles of their underarms; they're sweating throughout their whole body. And for those people, the things I mentioned are not really appropriate. For those people, there's a pill that is an anticholinergic pill that's not FDA approved either. It's FDA approved to treat nausea, but not underarm sweating or not whole body sweating. I said, but it's an anticholinergic pill, and
Mhm.
glycopyrrolate's its name, and we've been using that what we call off-label for years, meaning it's on-label for nausea and vomiting, but we use it to treat whole body hyperhidrosis as well,
Mhm.
and that works very well. And I'll tell you an interesting story. I once did have a stomach virus, and I took that pill for nausea
Mhm.
and I had all the side effects of anticholinergic medications you can imagine. I had dry mouth, my pupils were dilated, and sometimes you have a little difficulty urinating. That's a side effect of an anticholinergic. I had all those side effects. But people who have hyperhidrosis, I've been prescribing this pill for 25, 30 years, never get any side effects. Why? Because their acetylcholine is so ramped up. There's no
Wow.
room for side effects. That's my opinion. So there's no room
Mhm.
for side effects. So they have nothing. So these medicines in this patient population makes a world of difference. And the people who have whole body sweating, the pill's a game changer.
Like what we mentioned, there are the over the counter antiperspirants. There's iontophoresis. So it really depends. I like to reiterate for all our for all those that are watching right now, it really depends on your preference, your lifestyle, right, and how your body responds to the treatments
Correct. No,
available.
the pill is only for people who sweat from head to toe all the
From
time.
head to toe, right?
That's
Okay.
a very small set of the population. 65, 70% of sweating is primary focal, which is just underarms.
Right.
Another 25, 30% are palm sole. And that's where the iontophoresis device is, for me, the safest first choice. If your whole body's sweating, if you're that small 5 to 10% where your whole body sweats, none of those choices are good. The pill is the best option. But the pill is really, I mentioned as a sidelight, but it's really the best option for people who sweat from head to toe.
From head to toe. Right.
You can't use a wipe. You can't use a deodorant gel. You can't use an iontophoresis device if you're sweating from head to toe. That's a
Right.
small subset of the population. But for those people who really suffer, there is help. But yes, for the
Mhm.
majority of the population that's primary focal, just under the arms and palms and soles, iontophoresis, like the Dermadry, which is the most famous and most well-known one, is a great choice, a great starting choice.